Hello, diabetes mindful community. Today, let's talk about yeast infection for women with diabetes. In this video, I will explain what yeast infection is, why it's more common for people with diabetes, the symptoms to watch out for, and most importantly, some practical tips to prevent it. So let's dive into the video. Yeast infection is caused by an overgrowth of a fungus called Candida, which normally exists in small amounts in the body. This fungus lives together with other bacteria, but under certain conditions, it can grow too much, causing an infection in women. It is commonly found in the vagina area, but it can also happen in other warm areas of the body, like under the breast or in skin folds. But the question is, why is it common for women with diabetes? Which brings us to our next section. The first reason is because of higher blood sugar levels. When blood sugar levels are high, extra glucose or sugar can end up in the urine, creating a perfect environment for yeast because it feeds on sugar. Higher glucose levels allowed Candida to grow, especially in warm, moist areas. Reason number 2 is weakened immune system. For people with diabetes, uncontrolled diabetes can weaken their immune system, making it harder for their blood to keep the growth of yeast under control and fight against infections. Next up is dry skin and poor circulation. Diabetes can lead to dry skin and poor circulation, especially in areas like the feet. Both of these factors, that is the dry skin and poor circulation, can contribute to infections including yeast infection. Antibiotics can also cause yeast infections as they can lead to an imbalance in natural vaginal flora. The fifth reason can also be because of pregnancy. So these are the common reasons why women with diabetes are vulnerable to yeast infection. Now that we understand why it happens, let's talk about how you can recognize yeast infection or the symptoms of yeast infection. Some of the common symptoms include itching and irritations in the vagina and vulva. That is the external part of the female genital area, for those who don't know. The second reason is a burning sensation, especially during intercourse or urination. Redness or swelling of the vulva is another symptom. Vaginal pain and sores, vaginal rash, a thick, white, odor-free vaginal discharge that looks like cottage cheese. 7 is watering vaginal discharge. These symptoms can be very uncomfortable, so if you experience any, it is best to check with your healthcare provider to confirm if it's a yeast infection so that you can start treatment immediately. Now, let's talk about the prevention, how you can reduce your risk of having vaginal yeast infection when you have diabetes. The first and most effective way to prevent yeast infection when you have diabetes is to keep your blood sugar levels under control. This is where it all begins. When your blood sugar levels are well managed, there will be less glucose available for yeast to feed on. So work with your healthcare provider to develop a plan for maintaining steady blood sugar levels. Next is good hygiene. Good hygiene is important, but take it gently. You can use mild and unscented soap with warm water to clean your vagina area. Avoid douching because it can upset the natural balance of bacteria and yeast, causing infection. The third tip is for you to choose underwears that are made from natural fabrics like cotton, which allows better airflow and helps to keep the area dry. Avoid tight-fitting pants and underwears that can trap moisture. The fourth tip is for you to avoid scented or perfumed feminine hygiene products like sprays, wipes, and panty liners. In as much as we want to smell nice, these products can cause skin irritation and upset the natural pH balance. So stick to unscented products whenever possible. The fifth way to prevent yeast infection is for you to eat a balanced diet. Did you know that eating a balanced diet can actually put your blood sugar levels under control and keep your body's natural bacteria balance? Reduce reduce your intake of sugar and avoid foods that are high in sugar. Sugar can contribute to yeast overgrowth. Adding prebiotics such as yogurt or fermented foods can also support a healthy bacterial balance. Tip number 6 is to change out damp or wet clothes as soon as possible. Yeast grow in warm and moist areas, so by doing this, it can help to reduce your risk of developing yeast infection. One of the most important tips is also for you to manage your stress level. Stress can impact blood sugar levels and even your immune system, making you more liable to have infections. So while all these tips can help to prevent yeast infection, it's very important for you to know when to seek medical help. If you have recurrent infections or your symptoms do not improve with over-the-counter treatment, make sure to check in with your doctor. Check out these videos on the screen for more diabetes insights and tips, and do not forget to comment below if you have any questions or additional tips to share. Thank you for watching, and I will see you in my next video. Ciao.